Hello, Holist Tribe. This is Dr. Heather Hammerstead here from Holist. I here have Dr. Jon Lin here. Hi, John.
Hello.
So we had another Facebook technology interesting morning here and somehow couldn't get on the live. So we are uploading this here for you guys to see. I'm really excited to have John here today for a couple of reasons. The first reason is that I have had a bunch of people on here recently where we've been talking about how difficult medicine is and how a lot of people are burning out. And you have a lot of stoke for medicine, sort of like me. And so I was excited to bring that to our message. And also because we have a ton of people talking about women's health. And today we're going to talk a little bit about men's health. So welcome.
Thank you so much for having me.
Yeah, so you are in Arizona this morning, and I'm in Idaho, so we are early birds. Me coming off of a night shift, and you just because you're an early bird, I guess, huh?
You bet. That's what residency does to us.
Yeah. So talk to us a little bit about, why you love your profession and why you love, urology and medicine and why you still have so much stoke.
Well, let me take you back. I'm an immigrant, legal immigrant from Taiwan. I came to the States when I was 11 years old. When I came to the States, big culture shift, language issues, and also we qualified for subsidized lunches. Unlike how things are now, where all the kids get a little card and you just put money in the card, so are the kids who get subsidized lunches. I physically had to get up, and after I was called, get up in front of the classroom and receive a little meal ticket.
Oh, yeah.
Imagine the humility and I felt ashamed to have to get a ticket instead of being able to pay for my 50-cent lunch. So that's how I started. And then my parents worked all the time, try to make ends meet. I didn't know what a vacation was until several years ago after I married, and then my wife scheduled a proper vacation. So that's how I started. And to be able to get into medical school, get into a urology residency, and to be able to be afforded the opportunity to be here and to do what I do, you can't imagine the gratitude that I have for just being here.
Yeah. When
I was in Taiwan growing up, America, the United States, it's literally translated, it's 美国. And literally translated, that means beautiful country. To be here in this beautiful country, to have all this freedom, to be able to do what I do, I can't help but to be grateful. And that's why I can't be unhappy. I can't be just, things are horrible at my work, at doing what I do. In addition, so gratitude is number one. After 52 years on this earth, I found that gratitude is probably the number one thing to be happy, so that you can enjoy this life. And secondly, I've learned about myself. I am not very good at being an employee, if you will. So knowing yourself is self-awareness and knowing how you tick is super important. And I've learned that I like to be able to control my environment and do the things the way I want to do it. If I see something that I want changed in my practice, I want to be able to pivot very, very quickly. So that having that control has been really, really good for me.
So what you're talking about, for people who may not know, you're in private practice, which means that you are an entrepreneur running your own business in Gilbert, Arizona, doing urology, whereas a lot of people may be hospital employees or maybe part of a big contract management group where you don't have quite as much flexibility.
That's exactly right. Not only am I in private practice, I'm in solo private practice, which allows me to pivot very quickly. And a lot of dissatisfaction from physicians is lack of control over your hours, lack of control over the staff that you can or cannot hire, lack of control over supplies and protocols and being able to effect change quickly. Who knows better than the people in the trenches what works best, right?
Yep.
For the employee physicians, they have the bureaucrats telling you how to run your business, how to run your practice. So that's part of the reason why I'm so happy. I have control over my environment and I can constantly iterate and try to make things better on my own terms. And again, you have to understand who you are. If you're happy being an employee, that's great. More power to you. But for me, I enjoy the autonomy and the speed to pivot to improve the practice.
Yeah. So my emergency medicine company, we're our own owners, right? But we have a lot we can't control, right? We can control how we pay ourselves, and we can control, you know, our staffing and things like that. But the nurses and the staff belong to the hospital, and the patients, I mean, you can't control emergency medicine, right? You never know what's coming. But in terms of the private practice portion of that, I totally get it. And also, you know, what I've talked about with other physicians is, you know, one of the things I love about what I'm doing with Holist is trying to remove those middlemen. And I think a lot of the reasons why patients are really dissatisfied and physicians are dissatisfied is because we've lost that ability to kind of sit down together without the insurance, without the, you know, the legislation making changes, without, you know, the administrators, everybody. And so really pulling patients and doctors together so they know each other, and also physicians and physicians together so we know each other, right? Because it's really easy to just work in silos and get lost.
Absolutely. And also, I do a lot of interviews. I interview other physicians in my practice as well. And being able to connect that way, and now physically and also now virtually, is so important.
Yeah, absolutely. So you work with other physicians to help them optimize their practice environments. Talk to us a little bit about that.
Yeah, so I'm very fortunate in that I have so I'm going to say something controversial. The number one job of physicians is to take care of patients, but to run a profitable business. Why? Because without being able to run a profitable business, you won't have the privilege to take care of patients. Yeah. No matter if you're in private practice or if you're in corporate medicine, you have to understand the business aspect of medicine. I learned early on, and I also I did not go the traditional route of college and then medical school. I worked a little bit. I worked in entertainment business management in a CPA firm. I started a computer consulting company. So I have a little bit of business background, which allowed me to really take advantage of that knowledge when I started private practice. So understanding the business aspect of medicine, I think, is just supremely important.
And we don't learn that in medical school or in residency. We don't learn it.
No one ever taught us that. And I think that's part of the reason why I'm so happy, because I understand how the third party system works. And I understand how to get the new patients into the practice. Having learned that and having run a very, very successful practice, I invite other urology practices, and actually from all different fields. I help a lot of startup physicians who find me somehow, and I help them work through the pro formas and help get bank loans, and even local urology competitors, if you will. I don't consider them as competitors. They have come to my practice, see how the physical layout is done, and I show them, okay, this is why I have it set up the way I do.
Yeah, I mean, if you're doing well enough, they're not competitors, right?
And actually, there are just so many patients. Yeah. There's so many patients and such a huge shortage of urologists, shortage of pretty much all physicians. And there's really no competition. You can pretty much do just a minimum amount of advertising on Facebook, Instagram, or traditional advertising and get the type of patients that you want to see. I feel badly for you in emergency medicine. You don't have any control over who comes to see you.
But I've got job security, you know? I mean, people are always coming to see me.
and you have pretty much shift work. And I would say I have pretty much shift work too, because I see patients during business hours, and that's all, pretty much it most of the time.
Yeah.
But having been very successful in my practice, I invite people and practice managers, their PAs, NPs, and head medical assistants to come to the practice, and they have come visited from all over the country. I showed them, I lift up the hood and I showed everyone how we do the billing, how we do the collections, how we run the back office, how I do procedures, vasectomies, and in-office enlarged prostate procedures and all that stuff.
Yeah, so awesome. That's great.
So instead of 52 years old, I'll be 53 later on this year. I've learned that that's it. I'm halfway through life, right? So for most of us, I am looking forward. Go ahead.
Let's hope, I said. Yeah.
Yeah. I'm looking forward to not just leaving a legacy with my kids or with my patients by taking care of them. I want to leave an even bigger legacy by helping other practices, other physicians, so they can help other patients and their families and influence their local communities.
Awesome.
So that's why I do what I do.
I love that. So we're going to shift to the sign behind you, the all juice and no seed, and talk a little bit about your two procedures, your vasectomies and your UroLift. So for our patients who are watching who may not know what these procedures are, talk to us a little bit about, why they're so important and who they're good for, and, anything you want us to know.
Unlike a lot of the things, lifestyle medicine, vasectomies or sterilization is something that you can't treat with lifestyle medicine. So if you are happy with your family and you want to have permanent sterilization as a man, vasectomy is a solution. And when I first started, it took me 30 minutes and I was wearing these big old loops. I made 2 incisions and it was a big struggle. But having done so many of these procedures, it has become second nature. It takes less than 10 minutes. We do it mostly in the office. We provide IV. We can provide for the guys who are super anxious, IV sedation. I also have nitrous oxide or laughing gas for the guys who are a little anxious. And we can take care of this in less than 10 minutes. Permanent sterilization. I don't take any shortcuts. And for the guys who are family, who is very, very happy with the size of his family, this is a way to go. And it helps a lot of women too, in that you can enjoy sex. For a lot of my female partners, they don't have to worry about pregnancy, so they end up enjoying sex more with their partners. Well,
and for most of our lives, right, we've been the one who've been bearing the worry and the, whatever contraception that we were having to take or insert, and so it's freeing for sure to be that part of life. Yeah.
Yep. And all juice, no seed is just one of those taglines that
urology joke.
So I bought the domain name all juice no seed exterminator.com.
I love
it. and comeworryfree.com.
Perfect.
Things that only urologists can do.
Right. Oh yeah, that's great. That's good.
And the other thing
tell us about the UroLift. Yeah,
the other thing that you mentioned is that UroLift. So UroLift it's a minimally invasive procedure that treats men with enlarged prostates. In the past, we have medication, which has side effects. And recently, we're finding that one of the very, very common medications called tamsulosin or Flomax is associated with dementia, not just retrograde ejaculation, possible erectile dysfunction, nasal congestion, and things like that. Finasteride, the other medication, is associated with depression and possibly suicidality. In addition to breast enlargement, permanent erectile dysfunction, called post-finasteride syndrome. So those are things that I worry about when I prescribe these medications. So you have medication, and then on the other extreme is Roto-Rooter, TURP, laser, and HoLEP, or holmium laser enucleation of the prostate. These are more morbid procedures that we have to do in the operating room. There's got to be a happy medium. Well, this company over 10 years ago, NeoTract, created something called the UroLift system. It's a minimally invasive procedure that can be done in the office under IV sedation. It takes about less than an hour to perform, and the patients suffer no side effects such as erectile dysfunction, retrograde ejaculation. Most patients do not need a catheter, which a lot of guys hate.
Yeah.
And it's just putting in a punch of these tiny little implants. I don't know if you can even see it right there.
See it. Yeah, totally. Yeah.
These tiny little implants transurethral through the urethra without making any cuts on the patient, and they recover within a week or two. I've been so successful in doing it, that's in providing such a great experience for the patients and great outcomes, that I've been very fortunate to have been recognized as a center of excellence by NeoTract. I also have over 110 patient testimonial videos on YouTube just for that procedure alone. It's a game changer. Such a great procedure for men.
How common is it around the country? Are there plenty of other people who are doing this? Because I haven't heard of it.
No kidding. Okay.
Yeah.
They need to
I
up
mean, I
their
also don't talk to a lot of people about their prostate surgeries unless they come in post-op with a complication, right? So
post-op, or they just go into the ER in acute urinary retention.
yeah, yeah, yeah.
Yeah, so now you know, not just medication, not just roto-rooter. Now you have an in-office procedure that can be done. It
Yeah.
has, let's see, how many procedures? Probably 70,000 men have been treated with the UroLift system in the
Awesome.
U.S. It's FDA approved in 2013, and I started doing it in 2015. I've treated over 300 men with the UroLift system. Very, very effective.
Yeah. Is there a reason why you would not be able to do that and they would end up with a chirp or something like that? Like, is there a size or something like that of the prostate that kind of keeps them from being able to have that more less invasive procedure?
So yes, yes. So if they have a stricture, or if they have a bladder tumor, or they have certain configurations of the prostate which make them not a good candidate, but I have found that most men are good candidates for the UroLift system.
Yeah,
So
cool, awesome.
size wise, you're supposed to get an ultrasound of the prostate to measure the volume of the prostate. So anything under 80 grams, that's the party line. But once you're very proficient at doing it, you can tweak that and push the boundaries of those guidelines.
Perfect. That's awesome. Well, it was really great to talk to you. You know, here at Holist, I really like pulling together physicians to get to know each other and support each other around the country. I love educating our patients and other physicians about what we're doing within our own specialties. And as a reminder for listeners, what we're doing here at Holist is we're doing some integrative care coordination. So I'm working on pulling together alternative and conventional practitioners and physicians in teams. We're also doing lifestyle medicine, telehealth consults. So if you want work on weight, food, sleep, stress management, cognitive behavioral issues, or exercise, we are here for you with transformative 12-week programs for coaching, but also medicine consults. And so reach out to me if you're interested. And it was really great to see you, John, and we will see each other on social media around. Thanks so much.
Thank you so much for the opportunity. Best of luck with your ventures.
Thank you. Bye.
Bye-bye.